Hello team, welcome back to this video. In this video, we will discuss about how we can do the dental procedure, perio exams, and dental perio comparison and dental charting. This video is continued version from our last video, which is discussed about the patient appointment. So let's assume our patient has arrived in time so that we would do the procedures needed for that patient. So the first thing that we have to see is dental procedure. So for this dental procedure, as you can see, we have the patient, the procedure code, the procedure date, the status of procedure. So whenever you do update it, you come back to this procedure and update it. After you have done that, you would also link the provider, the appointment also, which appointment lead to this procedure. So all this would be created. So whenever you select this procedure code, we will track the fee, the insurance estimates, and the patient estimate. So as soon as you select this will be populated, so you don't have to worry about it. So this is the dental procedure. The other document that we have to see is dental perio exam. Dental perio exam also is one of the examination service that you would give. So perio exam is a simple document. You would record about the current status of the patient. So the name of the patient, the exam date, the provider, the POP percent, and the measurements. But also for all the thesis, you will create a recording of each details. So we will record this facial lingual here. All the numbering will be done here. So whenever you do this update, it will be calculated out of the formula which is given by the BOP calculation. So whenever you have this BOP checked, it will be updated there. So if there is a fraction 1, fraction B, you can see it here. All this calculation will be done for each observations. So this is how you would record for it. This is for the universal numbering to the number 1. So you would do for all the 32 tests. This is all about dental perio exam. So after you have done that, you might want to compare it from time to time, or you might want to share it with your patient to see the comparison. So I have made this perio comparison tool. So this, whenever you select this patient, the examinations will be populated. So this one has no exam. So how about this one? This patient might have examination taking place on different dates. So you can compare from 2 examinations. So when you click on this compare, you can see that this is the baseline and this is your current dental perio exam, and you can compare the differences between these two. So you can display it using projector or some screen for your patient. And also, last but not least, our major tool for this dental clinic is dental charting. So as you can see, these are all the teeth of a human or a patient. So we will record every detail about that teeth using this dental charting. So you will select the provider and the patient. So if there is a history before, you would load that history. You click on it. So you have done that, you can update every details about that patient. So if this thesis, every thesis coded on the universal coding or the Federation of Dentists coding version. So if we select universal, you can see 1, 2, 3, 4, 5. If you choose the FDA version, you can click on that one and you would see the coding of FDI. After you have done that, this is the upper maxillary and this is the lower maxillary. So if this is missing or it's implant, you can update it here. So this will be updated about here. If there is a mobility, you can select about this teeth. If there is a fracture, or if there is a sensitivity, it all will be updated. So you have done that. If you have made some changes for on this teeth, you can click on if you have made the crown, you can select it. Whenever you made a crown, there are the surfaces of each teeth. So you can select I made the crown for all of them or the middle one. Everything will be updated. So the filling will be on the OI. And if we load this one, it will be updated in every summary. You will see it here. So for every thing that you would do on that is, for example, if you do the filling on the all sides, you can see, you can put the observations here. So when you apply this record, you can click on this observation. So I have made this filling because of this reason. You can put it there. After you do that, you would select the generalized notes and the treatment plan procedure you have done on this teeth on this specific visit. So you, after all, you would save chart. So whenever I think I have saved it. So after we have done that, we can export it to JSON, or you can give it for a patient using a document file. Or if you have any question regarding this one, I am open to answer. So more or less, this is the details about this dental module. One last thing is about the insurance and insurance coverage. So after you have done these operations, you might have an insurance covered for this patient. To do that, you first have to add the insurance companies that you would have contract with. After you have done that, for dental insurance plan for every visit, you would put the dental insurance plan types. So there might be a percentile that might be covered from person to person or from company to company. You would just add this plan. After you have done that, you claim that insurance for that patient on behalf of that patient. You would create this document for this dental insurance claim. What you would do is you will select the patient name, the claim type, primary, secondary, pre-auth, and the insurance plan, and all the dates, the date received, and the prices that has to be covered for this procedure, this amount, all the tooth numbers, total tooth numbers that the procedure has been taken upon, all the, if there is a write-offs, if there was a deductibles, all the bill amount and the patient portion, you would update it here. So you have done that, you will be updated here, and it will be sent for that insurance company, or depending on the structure of insurance claim, you can give it for the respective body. One thing that I have forgot is to, whenever you do this dental perio exam, if you have to attach any x-rays or any files, you can come here and attach it using attachments. And if you have to give this document for other part of the facility, for example, from observatory to the x-ray room, from the x-ray room for the lab room, you can assign that person here. After we have done that, you might want to also to print this exam and give it to the patient. So to do that, you would select this print format, and here is the colorful print format for you, so you can give it for that person. And so this is more or less what the dental module would look like. If you have any question, you're welcome